suffer from phantom sciatica pain, or maybe you have this pain going down the back of your leg, but you're not sure if it's sciatica or if it's like a phantom pain, usually will come on when you are sitting for a long period of time. For instance, if you're traveling in the car, if you're sitting for work, or if you're at a conference. Well, then today's video is for you. So today we're talking about phantom sciatica pain, which is different than traditional sciatica pain. So traditional sciatica pain is the pain, it's sharp, it's shooting, it's burning. A lot of people say it's electric feeling going down the back of your leg. If you have that, I want you to check out this video over here, because that's going to discuss true sciatica pain. What we're talking about today is phantom sciatica pain. So it's pain that goes down the same pattern. So it still goes down the back of the leg, usually starts in the low back or the buttock, just like traditional sciatica pain. But it's a phantom because it's not really the nerve. And how you know that is it's more a sensation of tension, or a sensation of like a gentle pain, but it's not that stabbing, sharp, shooting, angry, on fire pain that most people discuss with sciatica. Most people who have phantom sciatica pain have this after they've had sciatica. So you've had that sharp, shooting, burning, electric. You're nodding your head right now. You're like, yes, I know that, but that problem healed a year ago, 5 years ago, 10 years ago. What I'm feeling now is like a shadow of that pain. That's a phantom sciatica pain. So if you're wondering why this happens, that's what we're going to talk about today. Usually when there's a phantom sciatica pain, it's because the nerve is getting slightly irritated, but not to the same degree that it was previously. As I mentioned earlier, this most often occurs when you're sitting for a prolonged period of time, and especially if you're sitting in the car for a long car trip. There's something about the compression that happens when you're in a car that definitely seems to make things worse. But if you have an active job where you're usually up on your feet, but find yourself sitting all weekend, maybe at a conference, maybe you're visiting with family and friends, and you're not as active as you usually are, that phantom sciatica pain can come on. And this can be a really big problem. You see, when you start to have those symptoms down the back of the leg, that can make you want to do all the things that you do when you have your sciatica symptoms, which usually include resting initially. So when you have sciatica symptoms and it's that sharp, shooting, burning, electric type pain, usually you need to rest for a day or two to get things to calm down, because everything's super inflamed. That's the opposite of what you want to do with phantom sciatica symptoms, because most of the time those are caused because you have been resting more than normal. So I've suffered from sciatica previously, and I noticed I was having phantom sciatica pain after being at a conference recently, where I flew on a plane, then I sat for 2 days, and then I flew home on the plane on the second day of the conference. And by the time I got home, the back of my leg was really tight. It was not sharp and shooty, but it was really tight. It was really angry, and I needed to get to work to start relieving those symptoms as quickly as possible. So I'm going to give you my formula for dealing with phantom sciatica pain. Now, it's really important that you understand this is not sciatica. If you're struggling with that, go watch one of the other videos, because this is a totally different beast. So with true sciatica, when it is sharp and shooting electric type pain, you need to rest for 24 to 48 hours, let everything calm down, and then gently return to exercise. And it needs to be more gradual and more moderate. But when you're having the phantom pain, you're getting more of that fascial tightness. Those muscles are tightening up. They're remembering that sciatica pain, and they're preparing for it to come. You need to be more aggressive at the beginning of that to get it to go away. And I'm going to give you my formula for how to do that. First thing you want to do is you want to start stretching. What do you want to start stretching? Your hip, so your figure 4 stretch. You want to be stretching your hamstrings. You want to be stretching your calves, including your gastroc and your soleus. And you want to make sure that you're stretching your quads and your IT band. So all of the muscles that cover that hip and low back area, you want to make sure you're stretching. Now, I always like to do both sides, because if one side's tight, I don't want the other side to be tight either. So I prefer to do both sides, but you definitely do want to be stretching that phantom sciatica side. The second thing you want to do is get back to your activity. So whatever that is that you normally do. Now, if you have not been walking or running or biking or swimming or whatever, doing an activity regularly, and you have this phantom sciatica symptom starting, don't burst into an aggressive program, okay? But if you have a program that you've been doing regularly, or at least semi-regularly, that your body's used to, that is cardiovascular, I want you to get back to it as quickly as possible. Getting the blood flowing helps to decrease the tension in the muscles. It brings blood flow to the fascia. It's going to clear up any inflammation that's around that nerve. It's going to calm things down, and that is super important as quickly as possible when you have a phantom sciatica pain. The third thing I want you to do is actually what I want you to avoid. So I want you to avoid bending forward from the back. Okay, so this is definitely the time we've got to be super careful. That sciatica nerve is telling us, hey, I'm getting a little irritated, I'm getting close. So we want to take really good, careful precautions at this point and make sure that we're not bending from the back. So make sure you're using that good form with lifting, you're bending your knees, you're bending at your hips. If you're doing any exercises like squats or lunges, you need to make sure you're doing really good form with all of those. And I also recommend, although working lower body at this point, if you do any weighted or resistance workouts is a good idea, be very careful if you're doing any resistance or weighted work to the upper extremities. So obviously when you're holding a weight, that puts more compression on that low back, which obviously can become a problem with that sciatic nerve. So make sure that you have excellent form, especially if you're doing any heavy lifting. I recommend that you not do anything that's overhead with weight, just because that increases the compression to that low back and could potentially cause a problem with that sciatic nerve that turns it into a true sciatica. When you've already had sciatica before, it's more common to have this phantom pain. But this pain is kind of although it's a shadow and it's different and the treatment for it is different, it's also a warning. It's saying, hey, this is kind of irritated. I don't like what you've been doing. I need you to change things. That's great. You got a warning this time. That's fantastic. Let's make sure to listen to it, to get our bodies moving in an appropriate way that it's used to moving. Increase the blood flow so that it decreases the tension and the stress on that sciatic nerve. Because if you've had sciatica before, you will do absolutely everything to keep it from coming back. And if you do these things and start on it really early, it will not lead into a sciatica problem. However, let me caution you again. If you are having sciatica pain, so again, that sharp shooting electric knife-like pain, these recommendations are not for you. This is only if you're having that phantom pain. So it's pain that's going down the back of your leg, but it more feels like a tensioning or a tightening, or you just feel like, I just want to stretch it out. That's what we're talking about here. So yes, those pains you can stretch. You want to do some cardiovascular exercise, and you really want to protect your back motion and be really, really careful about your form with the activities that you're doing. So again, if you do suffer from true sciatica pain, I'm going to have you check out this video here. If this was helpful, definitely drop a comment below and click that subscribe button. Have a great day, everyone. Bye.